Number two, side effects. People often quit using topical minoxidil within the first 12 months because they experience side effects. Now, those side effects might be headaches, it might be contact dermatitis, so itchiness of the scalp and irritation of the scalp. It might be hair growth in unwanted areas like the sideburns and on the face, which is especially problematic for female patients. Might be that they get flushing. I've also had patients have strange dreams. So there is a raft of different side effects that can put people off using this particular drug, and then they cease it well within that 12 months period because that often happens within the first few months of using topical minoxidil. So what can you do to reduce the potential side effects? Well, if we just take it back to the contact dermatitis. So often, the contact dermatitis, so the itchiness and the irritation of the scalp, is actually not caused by minoxidil itself, but it's caused by the formulations or the base that minoxidil is formulated with. So that can often be propylene glycol, it can often be alcohol bases and preparations, and those things irritate the heck out of your scalp. So if you can elect to find minoxidil formulations that you can use topically that do not have those irritating ingredients in it, then you're going to have a better chance of not irritating your scalp, which will then lead to better compliance. Other things I've seen are patients that have had facial flushing or headaches when they've started on a 5% concentration of topical minoxidil. When we've actually reduced it down to 3%, they tend to have less of those side effects, and then that obviously can improve compliance. So it might be that you need to reduce the concentration of topical minoxidil that you're using so you can still get some benefit without the side effects. Then with respect to getting hair growth in areas that you don't want it to, well, it may well be that if you just convert from using a minoxidil serum to a minoxidil foam, you'll be able to better isolate the minoxidil application to the areas that you're concerned with without it running down the side of your face. So serums sometimes can, if they're quite serious in nature, can flow down the side of the face and can get into areas like the face or the back of the neck or the sideburns where you don't want it to take effect. So if you convert to a foam, it's going to stay more localized and it actually absorbs into the tissue a bit quicker. The caveat being is that, however, you don't want to just apply it to the hair because the hair is not going to have the effect. You want the foam to be applied to the scalp as best you can because we want it to absorb into the scalp, not into the actual hair, which is just dead rope hanging there off the scalp.